More than 4,000 nurses traveled to New York City to help out at public hospitals during the height of the pandemic. For many of them, it was their first time here, an experience they'll never forget, and one they say we shouldn't either.
There's patients everywhere. We're trying our best to treat everyone that we can.
We saw firsthand how the virus overwhelmed many of our local emergency rooms. But for the first time, we're hearing from the nurses who dropped everything and traveled to help save lives. Registered nurses from Eastern Pennsylvania.
I just tell everyone it was a medical war zone. It was like a tornado went through the hospital.
To Columbus, Ohio.
It was something that I never thought that I would ever see ever in my lifetime.
To El Paso, Texas.
You had to harden your heart while you were there.
The nurses we spoke with were assigned to Coney Island Hospital, a public hospital in Brooklyn, a zip code hit hard by the virus. Close to 300 people died of COVID-19 in the surrounding area alone.
It was just complete chaos.
The traveling nurses say at one point, each were responsible for treating more than 20 ICU patients at a time, something New York City Health and Hospitals denies, saying at no point was one nurse caring for that many patients.
Most of everybody that was regular staff there was off on leave.
And while treating multiple patients, the nurses were left wearing the same personal protective equipment for multiple days at a time.
I was very nervous that I was going to get sick myself, and so it was very scary.
It's hard to tell, but that's nurse Samantha Phillips under all of that gear.
They were handing out N95 masks, and they told us we would get one every 5 days. And then they told us that they were out of everything else.
Even when their gowns were soiled with feces and blood, something nurse John Garton experienced firsthand.
I was told it wasn't enough blood that I would be all right. I was dumbfounded by it. I was flabbergasted.
The nurses say they reached out to their team leader, a fellow travel nurse.
It was an unimaginable hell, to be quite honest.
Dan Gustafson says after spending days rewearing equipment, he found this behind a closed hospital door, a storage unit full of supplies.
Literally pallets of PPE. I was like, whoa, wait a second. They've been telling us through the most dangerous pandemic in modern history that they don't have this stuff?
A hospital spokesperson tells us, like all hospitals, they had conservation efforts in place, but that all workers had access to the necessary PPE for the patients they cared for.
I was in disbelief, how could they treat us like this?
The hospital says patients were isolated in different zones based on their symptoms. But the travel nurses say when it came to caring for COVID and non-COVID patients, there was little distinction.
We never separated the sick from the healthy, no matter what it was.
Some of the nurses themselves tested positive, like Eileen Diaz, who quarantined for a week and went back to work.
I had a headache, body aches, and I was just so tired.
Would you do it again?
I honestly don't know. I don't know.
If another wave hits, they believe more nurses, more equipment, and more separation is needed to improve care and to help save lives.
We literally just didn't have the resources. We were choosing who lives and dies.
In a statement, New York City Health and Hospitals said it is providing the highest quality of care to all New Yorkers in the face of an unprecedented global pandemic. Lives were saved across our city at the virus's peak thanks to the heroic efforts of our staff. To read the full statement, head to abc7ny.com. Dan Krauth, Channel 7 Eyewitness News.